Well, good evening, everybody. We are so happy to have all of you here. We are so happy that this is our penultimate Lemons to Lemonade lecture for 2025. Don't worry, there will be more in 2026. And we are exceptionally happy to have Stefanie Simmons, MD, FACEP, here to present. Stefanie is the Chief Medical Officer at the Lorna Breen Heroes Foundation and a board certified emergency medicine physician. She was the primary advisor to CDC NIOSH for the Impact Wellbeing Guide for Healthcare Leaders. She leads multi-state programs to improve the operational environment of care and remove barriers to mental health care. And she serves as a national thought leader in healthcare worker well-being. Stefanie served as the Vice President of Patient and Clinician Experience for Envision over 7 years, serving 26,000 physicians and advanced practice providers with a focus on professional well-being, including translational research and programs designed to bring well-being best practices to clinical environments. She served as lead clinical faculty for the Clinician Experience Project Wellbeing Program. Stefanie earned her Bachelor of Science and medical doctor degrees from University of Michigan and completed residency training at the University of Michigan St. Joseph Mercy Emergency Medicine Residency. She's completed additional training in medical education, research methods, coaching, and positive organizational psychology. So as you can see, Stefanie has done a lot, and we are so happy to have her here to present this lecture this evening.
I'm really happy to join you all this evening. I know that evening time is often precious, and so I'm very grateful to have this time with you. And I know that you'll find it valuable. So today I'm going to talk about the Dr. Lorna Breen Heroes Foundation, the All In Coalition, and the work that we do together. And I want to start by sharing Lorna's story. So this is Dr. Lorna Breen. Some of you may know her story. Some of you may have known Lorna. But for those of you who haven't heard her story, Lorna was an emergency medicine physician practicing in Manhattan, in New York City. And she came back from a family vacation to care for patients in the first wave of the COVID pandemic. I think we all have a really visceral memory of the sights and images coming out of Manhattan in those first weeks. And many of us experienced something similar, either days or weeks or months later. Lorna came back to that environment and was caring for her community, but also her team, because she was the chair of emergency medicine at her hospital. She was working hard to make sure that people had PPE and could practice safely, was working around the clock to care for patients, and ultimately contracted COVID herself, as so many people did. She came back to work 24 hours after her fever broke, as was the recommendation, like so many people did, and began working again, extended hours day after day, long into the second shift of the day to care for patients and for her team. She became exhausted, and she was physically exhausted, she was mentally exhausted, she was emotionally exhausted, and eventually had difficulty even getting out of a chair. And she called her little sister and had a conversation with her about what she was experiencing. Well, they worked with her friends, her colleagues from medical school, from residency, to bring her out of New York back to Virginia, which is where she was from. Because remember, the airplanes, right, weren't running. And she received her first ever mental health care. And after she was discharged from that care, she expressed to her family that she was so burdened by the fear that that care would cost her her career and would cost her her ability to care for patients. It would cost her her reputation, her license, her credentialing. And ultimately, Lorna died, and Lorna died by suicide. 12 hours after her death, the New York Times published an article about Lorna's life and her death. And first dozens, and then hundreds, and ultimately thousands of healthcare workers have reached out to Lorna's family and now to the foundation, sharing their own experiences, their feelings of fear about seeking care for mental health conditions, for substance use disorder, and their fear about what that will mean for their career. They also shared the real struggles that healthcare workers are experiencing in the workplace, including an environment that contributes to the stressors of patient care instead of supporting them universally. And so the Lorna Breen Heroes Foundation was started both in honor of Lorna, but also in honor of those thousands of healthcare workers who reached out to say, we need more. So we envision a world where seeking help is universally viewed as a sign of strength for healthcare workers, including mental health care, and that every health worker should have access to care and support. And not only that, but the operational practices and processes that drive burnout are changed to improve healthcare workers' mental health. So I want you to keep those aims in mind as we go through and talk about the work of the foundation and how we're attempting to live this mission and to bring this vision about. There are 22 million US health workers. That includes everyone who works in healthcare. It is the largest employer in our nation. And health workers, in the words of the CDC, are experiencing a mental health crisis with increases in burnout, higher levels of poor mental health days and harassment, and higher levels of intent to leave their job than other professions. Now, we have seen the data on burnout rise precipitously during the pandemic and peak, and we now have 2 years of slight decline, but we are not yet back to the already elevated numbers that we were seeing in 2018, 2019. In fact, we're nowhere near them. And in 2019, the National Academy of Medicine declared an emergency of healthcare workforce burnout. So I told you Lorna's story. As the foundation has been doing its work, we've heard the stories of other healthcare workers who have died by suicide, whose stories and whose lives are shared with the foundation by their families. And we've also heard the stories of hundreds of healthcare workers whose paths took a different end, who didn't die by suicide, but who found help and who found a way forward. And so we always keep the faces and the names of the people who have died by suicide in our minds, but we also know that there is a better ending for many. So I want to talk about some of what we've learned and then how we are taking those learnings into action. And so this is Tristan Smith, who's a nurse who died by suicide, and she spoke about the workplace environment of care and how the resources and the work need to be matched. And that really drives home that this is about a mix of different concepts. It's about mental health access, but it's also about workplace environment. So as we think about the solutions that are needed for the healthcare workforce, we really think about these in two separate categories that are overlapping. And this Venn diagram is not intended to be an explanation of how mental health conditions and burnout are related to each other, but rather how the solutions relate to each other. So on the right-hand side, we see depression, anxiety, substance use disorder, and other mental health conditions. The solution set for those mental health conditions are to remove the barriers to accessing care that healthcare workers uniquely and non-uniquely experience. That includes invasive and stigmatizing language on licensing and credentialing applications, on payer applications, on professional malpractice insurance applications, but also issues of time and accessibility and cultural competence. We don't always work 9 to 5. We can't always make a standing appointment at 3 o'clock in the afternoon on a Thursday. And so thinking about how to access care and then how to access care from someone who knows what it's like to be a healthcare worker is an important aspect of this. We know that screening for suicidality and educating healthcare workers on how to intervene with each other through mental health first aid is a powerful tool, and that there needs to be confidential access to care. So yes, not asking about care on licensing and credentialing, but also having access to care from people that you don't necessarily work alongside every day, that you're not going to be consulting tomorrow, right? But that will remain confidential throughout your workday and your life. On the burnout side of things, there's really two sides to this. There's individual support and there's systems change. So there is a component of burnout that is individual, that belongs to the individual to address their coping mechanisms, their choices in their own health, and their own behaviors that help support their health. But there is a far larger component that is the operational environment in which they work. That is the system in which they work, that are the resources that are available to them. And so far from looking at this as strictly like training for an individual or support for an individual who needs to learn how to be more resilient, this is a systems change strategy where we look at the environment of care to improve it for the workforce. I'm an ER doc, so I like to think about this. Like if there's a bleeding patient in front of you, right, you have to hold pressure. That's the individual support, coaching programs, peer support, resilience training. But if you don't get to the source of the bleeding, that patient is still going to bleed to death. And so the systems change is actually addressing the source of the bleeding to make that difference. And then the common denominator, the common motivator between these two is leadership and culture. So how do we leverage the leadership of our organization and the culture of our organizations to make sure that these solutions are sticky and that they continually and consistently are applied? And so when we think about systems change, there's been overwhelming and repetitive and consistent feedback that bureaucratic tasks, administrative burden, and regulatory burden are some of the biggest drivers of that systems burnout. So if you look at this list, that I think these also drive too many hours at work. They can drive a sense of lack of control and autonomy as well. So when we are spending 50% of our time documenting, when we have to spend hours a week responding to inbox messaging, and there is no technological support for that, when the regulatory and the compliance training builds up and accumulates, and when we're not using tools that help, or we're not offered tools that help change that burden, this is a big driver of a burnout. We also know that healthcare professionals have an increased risk of suicide. And the three drivers of that risk include stigma, which includes the institutional stigma that we've been talking about with licensing and credentialing, but also includes internalized stigma, what we think it means about ourselves if we get care, and external stigma. How do we talk about mental health care within our profession, within our colleagues? And do we want that to be applied to us? And so we need to address stigma at all three of those levels. With regards to institutional stigma, we need to address the wording and the types of questions that are asked. With regards to internal stigma, we need to evaluate and examine our own thought processes and, frankly, apply the same compassion and care that we might give a friend or family member to ourselves. And in terms of external stigma, we need to be very thoughtful about the language we use when we're talking with our colleagues. Another driver of suicide in the healthcare workforce is inadequate access to resources and job-related stressors. And again, those job-related stressors include the avoidable stressors and the unavoidable stressors. We take care of patients on some of their worst days, and witnessing human tragedy, human suffering can be very difficult. We are taught through our training to compartmentalize, and we have to be able to compartmentalize. It's important. In the emergency department, I have to sometimes go from a room where I've just, had to tell a family member that their loved one died, and then in the next room, repair a minor wound. And so I need to be able to set that aside. And the analogy I like to use is that it's like you have a backpack on your back, and you're taking these experiences and you're putting them in the backpack. This is compartmentalization in its physical manifestation, right? But if you're always putting things into the backpack, eventually it becomes full, and you can be stuck on your back with that full backpack weighing you down, unable to get back up. So thinking about how to process and decompartmentalize those experiences and integrate them into your worldview and to yourself is equally as important as compartmentalization, but we get a lot less training on that. So at the Lorna Breen Heroes Foundation, we work to impact healthcare workforce well-being in three ways. We always say you can only do three things. It's helpful if they start with the same letter. So we have accelerating solutions, advocating for health workers, and advancing collaboration. And I'm going to talk about each one of these three areas and what we've been able to accomplish along with our friends. And then you all are getting this information at a very timely moment, because just today we updated our maps and we are able to give you the most up-to-date information about where things stand nationally. Okay, so first let's talk about advancing collaboration. We have brought together organizations and individuals from across the country. So in our All-In Wellbeing First for Healthcare Coalition, this is a group of leading healthcare organizations that work together to think about practical solutions to mental health care for the workforce and to improve workforce environment. There are 30 organizations in All-In, including the AMA, the ANA, and the AHA, and the Federation of State PHPs. We also have our ambassador program, which is where we bring together individuals, health workers, medical students, experts in the field of mental health and well-being, with the foundation to improve the understanding of how to protect the workforce and also to carry the message of the foundation out to others. And so these two forms of collaboration are really how we do our work in the world. I always say we get by with a little help from our friends, because without our all-in coalition members and our ambassadors, we would not be able to do the work that we do. So we do have programs together in All In. So in the introduction, you heard that I worked closely with the CDC and NIOSH on the Impact Wellbeing Guide. So this is a guide that was funded through the Dr. Lorna Breen Healthcare Provider Protection Act, which I'll speak more on later during advocacy, that was initially designed to be a communication campaign for healthcare workers and healthcare leaders about burnout. And as that communication campaign got launched, we heard loud and clear from healthcare workers across the country that they didn't particularly want to learn more about burnout. One commenter said, "I know a lot about burnout, thank you very much." What both healthcare leaders and healthcare workers asked for were solutions, things that they could do in their workplace that made a difference to the healthcare workers' mental health. And so we brought together our All-In Coalition members to advise on the Impact Wellbeing Guide. And this was 6 phases of work to make a difference to the healthcare workforce. So what we found when we piloted this with organizations, so about 100 organizations went through the pilot, is that in order to implement these changes, it really helps to be in a learning community. It really helps to have a group of people to go along and follow along the steps with. And so what we did was we formed the Caring for Caregivers learning communities so that we could take groups of organizations, hospitals, and health systems through the Impact Wellbeing Guide. So we have learning communities in the states of New Jersey, North Carolina, Virginia, Wisconsin, and with an employer, Jackson and Coker. And this work is supported philanthropically. And then again, we do this work alongside our partners in the state. You can enable check G. And so as you can tell, we're doing this in an interdisciplinary way with physicians, nurses, and the hospitals in the state. And what we found is that organizations are able to accelerate the pace of change much more rapidly when they are working together and across the state as well. So I'm going to give you some of the results of the Caring for Caregivers program in Virginia, which was our first state. We had 12 health systems partner together with us in Virginia, and that included 48 hospitals. They completed a leadership curriculum. So we had over 100 leaders from across Virginia completing a curriculum and then implementing an EHR optimization program that integrated professional well-being measures. So these organizations were implementing EHR technologies that reduced administrative burden. We also were able to get a state law changed to protect all licensed healthcare workers in the state by removing invasive and stigmatizing language around mental health care. And over 75% of the hospitals in Virginia also removed those questions from their credentialing application. And these results were published in the American Journal of Public Health as a change management program to help with this adoption of a best practice and really to close the implementation gap that we see between best practices and what's being experienced in reality. Something that I think is really cool happened here is that HCA Healthcare had a few hospitals in Virginia. And in order to change those hospitals' credentialing applications, they actually went ahead and changed the applications across all 186 hospitals and 124 surgery centers in their system, which in that change alone impacted 45,000 health workers. We also go deep with organizations. And so we've partnered with Chartis in consulting to help organizations understand on their individual organizational level how to strategically plan around professional well-being. We've also developed a scale that helps an organization understand where they are in the development of their professional well-being work. So organizations, when they start work around well-being, are often thinking about this compliance or physical safety model where they're following the rules and they're making sure people are physically safe. That goes through into like a workforce strategy where they really want people to be recruited, to be retained, and that there's a match between the work and demand. And then in mature organizations, we see an innovative quality approach where there's an understanding that the people who are being impacted by the healthcare system, whether those are patients or the healthcare workforce or the leaders, all benefit equally from interventions at the individual operation and systems level. There's really these three approaches: an organizational strategy, a leadership approach, and a systems approach that we assess across that continuum of beginning, accelerating, and mature. And so, for instance, under the well-being systems approach, you'll see that there's an operations systems approach and an individual support systems. And so that's really that balance between what are you doing for individuals versus what are you doing for the workplace. Are you teaching your leaders this approach? And is your board holding them accountable? What is your organization's goal, approach, and measurement strategy? That leads us to the Wellbeing First Champions Challenge, because an important part of any organizational approach is removing that institutional stigma. So certainly for Lorna, but for thousands of other healthcare workers who have been surveyed, who have participated in both quantitative and qualitative studies on this issue, the questions on licensing and credentialing applications about a history of mental health diagnosis, treatment, substance use disorder diagnosis and treatment serve as a barrier to receiving mental health care. Healthcare workers are worried about the privacy of their medical care, and they don't want to have that privacy broached through their licensing and credentialing process. And so what we see is that the questions on credentialing applications and licensing applications are really one of the primary reasons that healthcare workers say they don't want to seek mental health care. So we developed the Wellbeing First Champions Challenge along with our All-In Coalition to support licensing boards, hospitals, medical centers, and clinics and other facilities in changing their applications to be free of intrusive mental health questions and stigmatizing language, and to be consistent with best practices in this language. For organizations that are consistent with those best practices and who share their applications with us so that we can verify that they are consistent with best practices, we award a badge. And what you see here is the badge. So I want to point out a few things about this. Number one, you'll see that this is all in Wellbeing First for Healthcare. So this is a program that is hosted by our All In Coalition, which again includes those 30 organizations from across healthcare, including the AMA, ANA, AHA, FSPHP. You'll also notice a year. And so the first year that we're able to verify that an organization like a board or a licensing application or credentialing application is consistent is the first year we give the badge. In subsequent years, we ask them to assert that they have not changed their applications and also to tell us how they've spread the word, because it's important for people to know where they stand in their state and what to expect. You'll also notice across the bottom that this is for licensing and for credentialing. We also badge payers, so insurance companies and professional liability insurers as well. Our goal is that this badge serve as a source of truth for healthcare workers across the country on where it is safer to receive mental health care. And so the numbers that you see here are the numbers that as of May were being impacted with the program. So how many states or individual organizations were badged across the country. And I'm happy to say that as of our updating the maps today, we are now impacting over 2 million licensed healthcare workers. So as of the 19th of this month, over 1,800 hospitals, medical centers, clinics, and other facilities have gone through the process of verification. And so on our website, on our map, you can click on your state and the list of all the hospitals and health systems within the state that have been badged will pop up. And so you can check, has your organization been badged? The states that are light blue on this map have not had any organizations badged. But as you can see, almost every state across the country has had organizations badged. We've also been able to badge 2 insurance companies and several employers. For medical licensing, as of this month, 40 medical licensing boards have verified that their licensing application do not include intrusive mental health questions. And this benefits more than 1 million physicians. Now, the states that are light on this map, including Maryland, are states that we have not been able to verify that the licensing applications are free from these questions. So we suspect that at least 1 or 2 of them may have already made these changes, but without being able to see the licensing application and verify those changes, we do not issue the badge. We've also been advocating for and tracking this work for pharmacy, for nursing, and for dentistry. Now, you may look at these maps and say, oh, the dentists and the pharmacists and the nurses are so far behind. But it is important to recognize that they started with 0 states colored in when we started these maps, and that the Federation of State Medical Boards actually put together a white paper well before 2020, before the foundation existed, advocating for these changes. And it was the policy of the Federation of State Medical Boards, the Federation of State PHPs, and the AMA that really drove this change for physicians. So although there is more map to go, so to speak, for dentistry, nursing, and pharmacy, they are also sooner, right, in their change management curve. And so we see the early adopters, we see the early majority, the late majority, and the late adopters. And so what we're seeing here is the early adopters and the early majority in those three professions. And we are actually all the way to the late adopters in medical licensing. We have worked along with our All-In Coalition to put together a program of resources for those who want to be all in for healthcare workers' mental health. It's the idea here being that patients have a right to access mental health care, and healthcare workers have the right too. And so we've put together 6 core actions that are important to support healthcare worker mental health. And these come from our All-In Coalition working group. And they include exactly what we've been talking about: committing to equal privacy for mental health care, also ensuring accessible and affordable mental health care. And that includes mental health care that's culturally competent, that understands what it's like to be a healthcare professional and takes that into account. Also, strong confidential PHPs, confidential peer support, continuing education and training on mental health and professional well-being, and a supportive pathway for re-entry, both at the institutional level and at the licensing and state level, for clinicians who may have experienced a mental health impairment. So with these 6 actions, we're supporting the mental health of our healthcare workforce and making sure that people are able to have a healthy continuum throughout their career and their lives. In advocacy, we work both at the federal and state level. And so I want to tell you a little bit about this picture. This picture was taken on March 18th, 2022, which was the day that the Dr. Lorna Breen Healthcare Provider Protection Act was signed. This was first of its kind federal law that funded 45 organizations with grants to pursue and to deepen their work and professional well-being for the healthcare workforce. It also established the Impact Wellbeing Campaign through the CDC and NIOSH. This was really the first time that there had been a bill specifically to address the mental health of the healthcare workforce. Behind the president is a family. And the man and woman directly behind him are Corey and Jennifer Feist, who are the co-founders of the Dr. Lorna Breen Heroes Foundation. Jennifer is Lorna's sister. To Jennifer's right is Lorna's mom, Rosemary, who served as a psychiatric nurse for decades. And to Corey's left is Charlotte, who is Lorna's niece. Next to Charlotte is Senator Tim Kaine, who was a sponsor of the bill and instrumental in getting this passed. On the state level, we advocate for uniform licensure and credentialing, confidential mental health solutions to address localized challenges, including support for state PHPs. The Lorna Breen Act is currently in reauthorization. The reauthorization will extend the law for another 5 years, ensuring continued support for its programs. And there's 3 changes from the original law to the reauthorization. One of those changes is that it is 5 years instead of 3. Another change is a typo that's being fixed from the original to the secondary bill. And the third is a focus on reducing administrative burden so that healthcare workers can focus on their patients and on themselves. We also need to advocate for annual funding. So there's the bill and the appropriations so that the projects and programs can be funded every year. If you would like to contact your member of Congress, I encourage you to follow the QR code on the page, and it will lead you to a political action page. If you put in your zip code, it will populate a pre-written letter to your member of Congress. If they have already signed on to the reauthorization, it will thank them for doing so. And if they have not, it will encourage them to do so. If you feel moved to include details of your own story or why this issue is important to you, that letter will be even more impactful. The foundation works with partners, and we work consistently for impact. And that impact of our work and our partners' work has been recognized. I include this page because it is important for healthcare workers to know what work is being recognized in the country on this issue, and that there is attention to the needs of the healthcare workforce. So Corey and Jennifer Feist were awarded the Surgeon General Medallion of Honor, which is the picture here. And I want every one of you to know that there is attention to this issue, and that we are consistently keeping the lay media as well as the academic media focused on the needs of the healthcare workforce. So we work closely with lay media, social media, to continue to activate around the issue of healthcare workforce, mental health, and access to mental health resources, so that this issue stays at top of mind for people, so that they understand that this is important, that you are important, and that the healthcare workforce has specific needs. So that's our work, that's our why, and that's what we do. If you are interested in seeing change, in having your state board verified, and in having this work brought to Maryland in terms of the licensing, you can also contact your board. And so I have here as well a link to our contact the board action item. And I encourage you to write to your medical board, or if you are a nurse, pharmacist, or dentist, to those boards as well, to encourage them to apply for the badge, so that healthcare workers in Maryland know what the licensing applications say and are able to access those. I put that link in the chat, and it should be accessible to.
Well, thank you so much, Stefanie, for presenting this wonderful lecture tonight. I think everybody in attendance joins me in gratitude for your time and your expertise. And of course, thanks to everybody who's been here this evening to listen to what Stefanie's presented, to ask questions, and be part of this discussion. And I also want to say a special thank you to all of you out there who are viewing this on YouTube. Thanks for coming to the Center for a Healthy Maryland's YouTube channel and checking us out. Have a great evening. Take care.